Okay, our next presenters are Sarah Zito and Jacqui Rand from the University of Queensland to talk about university and shelter partnerships, which we've alluded to over the summit, but here's the detail. Thanks very much, Jacqui.
It was clear in the 4 years that Corinne was analysing the data that there was some glaring things that were standing out at us, and that one of them was to reduce the kitten intake into shelters. And that was something that I think that we can achieve and we can make progress on. And certainly decreasing the spay delay is a real feature of trying to make a difference. And that's where veterinarians came into the picture, and it made us realise that the students we were graduating, one didn't have any real idea, most of them, of the magnitude of the problem that was facing shelters, nor did they have any competence or really much awareness of early age desexing for a whole variety of reasons. And so we were very lucky to get a donation from a client who could see the vision that we saw, that where every veterinarian graduating was motivated to make a difference and had competency in early age desexing. Now, we're the first step along that way in the motivation and awareness of early age desexing, and I'm very grateful to the AWPCA and the Animal Welfare League and the resources they have invested in helping to teach our students. And Sarah Zito has pioneered this program at UQ, and she's going to tell you a little bit about what she's been doing. Thanks, Sarah.
Okay. Hi everyone, so my name's Sarah Zito and I am the shelter practice instructor at the UQ University of Queensland's shelter practice rotation. It's a real pleasure for me to be able to talk to you about this program, because those of us who are involved with it feel very, very positive about the impact that it could make in all of our battle to try and reduce the numbers of animals that are euthanized in our shelters. So there is an increasing worldwide call for more humane solutions to the unwanted companion animal problem, and so moving away from the model where lots and lots of animals are coming into shelters and that's resulting in many animals being euthanized just because there aren't enough homes for the numbers of animals that are coming into the shelters. And if we want to do this, then really what we're needing to do is introduce proactive measures to try and achieve these goals. So the goals that we're looking to achieve are obviously to reduce the numbers of animals that are entering our shelters, to improve the welfare and the outcomes for the animals that actually do end up in our shelters. We want to increase the numbers of shelter animals which are adopted into good homes, and increase the number of animals which are reclaimed by their owners. And this should lead to obviously a reduction in the number of animals euthanized, which is obviously the end goal that we're looking for. So the field of shelter practice or shelter medicine, depending on where you come from, is one which is really dedicated to positively impacting the unwanted companion animal problem. And I see it as a really vital part of achieving the goals of the proactive model of management which we're all aiming towards. So obviously there are lots and lots of benefits to decreasing the number of unwanted animals. There are lots of benefits to society as a whole, and these, some of them have been talked about already, but briefly they include reduced economic costs of managing the unwanted pets, and we've already heard that there are vast thousands of dollars spent even just in this country on this every year. There are also quite significant social costs involved with people having to euthanize large numbers of animals, particularly healthy animals, so compassion fatigue, burnout and stress in those people who have had to be involved in this, and this is leading to high staff turnover as well, which also has an economic cost as well as a social cost. There are obviously the most important benefits to all of us here who care about animals is that there are benefits to animals from reducing the number of unwanted animals, and the end goal of that is obviously fewer animals euthanized, but the benefit to that is also that there's more money, more time, and more possibility to improve health and welfare of animals in shelters, and also improve chances of those animals finding lifelong loving homes because there aren't as many of them. So I and the others of us that are involved in this program really feel that involvement of the veterinary profession in reducing the numbers of animals which die just because they are unwanted is really vitally important, and effective strategies and prompt implementation of these strategies really do need widespread veterinary participation and support in order for them to succeed. So vets are really vital to implementing these strategies which are aimed at reducing unwanted pet numbers, but they're also so important at educating the wider community, so not only their clients but also the general public. And in doing this, they can also change preconceptions, not just in the public or their clients, but also with other people working with them. So things like, people being traditionally quite reluctant to introduce early age desexing, or just educating people about how great shelter animals can be as pets. Having vets involved is also really important to enrolling the assistance of other vet professionals, so not just other vets but also their support staff, so veterinary nurses and managers and so on. And in getting all of these people on board with the ideas that we want to get out there, it's really helpful to have this number of people who are disseminating the ideas. So I see that there's a really key role for vets in private practice to help with, trying to reduce the number of unwanted animals in our communities. So Jacqui's already mentioned, and quite a few people have mentioned, that obviously preventing the birth of unwanted pets is one of those main roles. And vets in practice are obviously the ones who are advising on initial health programs for puppies and kittens, and it's really critical that vets do incorporate early age desexing in these initial health programs, particularly for cats. So another key role for vets in private practice is to try and increase the number of lost pets which are reclaimed from shelters, and part of that is just making sure that our clients are identifying their animals properly, but also that that identification is kept up to date so that their details are correct. So when we try and call them from a shelter to tell them that their beloved cat or dog is in there, that we can actually get hold of them, and that when they move they do update it. And not only do they use microchips but also physical ID as well. Again, the role of vets in practice in educating, I just can't stress enough how important I think this is. Educating their clients and educating the general community. We have a certain status within the community, and we also have the knowledge that we need to educate, and we should be doing that. We as vets out in practice as well really need to be addressing behavioural and health issues which lead to relinquishment, so that hopefully we can stop those pets from ending up in shelters in the first place. So vets in practice are really crucial to providing good advice on the prevention and treatment of problem behaviours, and we know that there are lots and lots of dogs which are surrendered for behavioural reasons to shelters, and some cats as well, and the majority of these animals do visit a vet in the year preceding their relinquishment, and so that really is an opportunity for vets in practice to help stop those animals getting into shelters in the first place. Vets in practice, I feel, can increase adoption of shelter pets as well, just by informing their clients about what great pets they make and also the benefits to having shelter pets. They've been desexed, they've been vaccinated, they've been behaviourally tested, so they are excellent candidates for good pets, maybe even more so than those pets which are coming from unknown sources such as backyard breeders and or newspaper articles or wherever else people are getting them from. And I also think that all vets, so not just shelter vets but also private practitioners, have a really big role in ensuring that animals in all shelters have the best possible welfare and outcome that they can in that area, and that is because there's not every vet, not every welfare group, not every shelter has the possibility to have a vet on staff, and so private practice vets are those people who are going to be helping those organisations. So We think that it's really critical that vet students are aware of the magnitude and the complexity of the unwanted companion animal problem, and that they have exposure to and training in small animal population medicine and early age desexing, and also that they know that they really do have a key role in preventing and addressing behavioural problems before they lead to relinquishment. So I think that veterinary education as a strategy is a really efficient and cost-effective way to make sure that we have vets on board who are convinced of the key role of early age desexing, particularly for cats, and that they also have the necessary skills to do that out in practice, and that they feel comfortable with doing that. And also that it's really important that we have vets who realise that they are really crucial in preventing relinquishment. So overall, taking all of that into account, all stakeholders can really benefit from graduating veterinarians who are better informed about the unwanted companion animal problem and who are really engaged in being part of the solution. So our rotation has been developed for this reason, and the aims that we have are to improve the awareness of unwanted companion animals problem and to inform on the challenges that shelters face because of that. We really want to instil a sense of responsibility in our new vets to be part of the solution, and we want to foster some cooperation between vets, shelters, animal welfare groups and governments, and it's already great to see a conference like this that is really working on that, but the more collaboration we have, the better. I think it's really, really important that we as vets act as animal advocates, and what we want our students to do is to be animal advocates, and that they also use that advocacy and they use their knowledge and skills to educate their clients and the general public about responsible pet ownership and about how big a problem we're facing with unwanted companion animals. So we also want to encourage our students to embrace the role of early age desexing in reducing the number of unwanted animals, and reinforce the importance of behaviour in pet relinquishment, but also in welfare, health and adoptability of shelter animals. And we also really want vets to be addressing health and behavioural problems before they lead to pet relinquishment. The other thing that we want students to do is to be able to apply the knowledge that they already have of veterinary medicine and surgery to a population setting. And traditionally, we are mostly taught about small animals with regard to the individual animal, and it's the same principles, but we just need to be able to apply them to a population setting. The other thing that we hope we can do is familiarise students with recognising animal cruelty, the laws involved and their responsibilities and the reporting procedure, so that they can be advocates for that as well. So our rotation itself consists of 6 full days for the final year veterinary students. 2 days of this are tutorials and interactive learning sessions, and during these what we're really trying to do is educate our students about the problem of unwanted pets and about shelter practice and the role that shelters play in addressing this. And we also really want to give our students ideas about what they can do to positively impact the unwanted pet problem from private practice as well as in shelters, because we're well aware that the majority of our graduates will not be going into welfare work, but we feel that they can have a huge impact from private practice. So the 2 days of theoretical teaching, we do a combination of lectures, case studies, question and answer sessions and problem solving activities, and we really try and focus on interactive learning because we want our students to be thinking like the vets that they'll soon be. We want them to apply their knowledge to shelter practice situations and really recognise that they have a huge capacity to make a difference when they're out in practice. So the students, they're assessed in the tutorials in the shelters, and they also do a presentation on a shelter practice topic. The shelters have input into the topic so that they can ask us to do things that they particularly want covered. The presentations are then shared with the shelter staff, and that's just one of our ways to try and give back a little bit to the shelters that are helping us out so much. So the AWL and the RSPCA have really led the way and been really visionary and invested in education as a proactive strategy to try and reduce the number of unwanted pets. and they're providing the practical component of our rotation. And I just want to say a big thank you for them, just not only for having the vision to get involved in this, but also to all of the staff who are involved. They put a lot of effort and time into having our students there, and I can't say how much we appreciate it. So out in the shelters, what's beneficial for the students, they're really being exposed to the reality of the numbers of animals coming into shelters and the challenges that that's meaning that shelters are facing and the kind of decisions they're having to make. And I think it's really hard for them and hard for anyone really to understand how hard it is in that situation until you experience it for yourself. The other benefit to having the two different shelters involved is that our students are getting experience of some of the differences in the welfare organisations and also the differences in shelter management. So the students are gaining a really indispensable perspective on the unwanted companion animal problem and also on small animal population management, but they're also getting a great opportunity to gain valuable practical experience as well. So they're involved in a lot of physical exams and routine treatments, pre-purchase exams, parasite control, vaccination, and some of these things, such as early age desexing and behavioural assessments, are things that they're not seeing anywhere else in their course necessarily, and so it's really important that they do get to see those in shelters. So the experience of the students in the shelters is really increasing their awareness about shelter health issues, and this is a real benefit to the sheltering community because the experience and the skills that these students are gaining out in the shelters mean that our graduates are well equipped to help their local shelters, and this is, I think, particularly important for those students who are going to go out into regional communities and work in those areas because they often are going to be their local shelter or pound or rescue group's only veterinary point of contact. So it's just so important that they are aware of these issues and know how to deal with them. So we have had some really positive feedback about the rotation so far, comments like this one that they thought it was a really great rotation and that it's opened their eyes to the problem and that it's made them want to be part of a positive contribution to helping the problem, and most of them have just said that they would like more time if they could get it. So we envisage the future involving a real recognition of the huge potential that these university and shelter partnerships have in helping to reduce the number of unwanted companion animals. And what we would like to see happen is that there's more engagement of animal welfare organisations and their local veterinary university to expand this kind of program out into their communities, so not just here in Brisbane but in the other areas where there's veterinary universities as well. And what we hope to achieve is that all veterinarians are graduating with an awareness of the problem and know what the shelter's role is in that, that they've had experience of shelters and of early age desexing, and that they really comprehend that they have a really key role as vets in preventing the birth of unwanted animals and in preventing relinquishment either for health or behavioural reasons. So in conclusion, our aim here is really to use education to ensure that the veterinary profession takes a leadership role in this struggle to address the unwanted pet problem. And I feel very strongly that as vets we should be animal advocates and we should be really part of the solution, and it really is our responsibility to be part of this solution. And I know a lot of vets, both in shelters but also out in private practice, do really great work in this regard, but there's always room for more. And what we want is that the veterinary profession is really instrumental in helping to improve the welfare and outcome for all animals, not just owned animals, but animals that are homeless as well, because they all deserve our help. And that's it.
And I'd just like to again back up that thank you to the RSPCA and the Animal Welfare League and the many individuals who on a daily basis are helping teach our students. And also to thank David and Margaret Perrell, whose donation paid for 1 day a week of Sarah's teaching time and have committed to do that again next year. And for those of you in other states and around other universities that are training veterinary students, I'd urge you to make contact with those universities and be proactive, because I think this is a really powerful initiative and has a big return on your investment. And it is an investment in time. Clearly, the staff in the shelters it does take up their time teaching, but I think the payback is enormous. And our vision is that all veterinary graduates around Australia, and that will be soon 700 individuals a year, are graduating motivated. They recognise their key role when they're in practice in helping to prevent relinquishment, helping to prevent overbreeding of unwanted pets. And the next step, we hope, is that our students will actually have the opportunity to graduate with hands-on skills of early age desexing and be competent at that. So that's our vision for the future.
Thanks very much, Jacqui.